Welcome back to the IndeVets Happy Hour. I'm your host, Dr. Andrew Heller, and I'm here with my co-host, as usual,
Dr. Marisa Brunetti.
Thank you for filling that in for me. I forgot your name for a second.
Oh my goodness, it's been too long then, apparently.
Been too long. All right, I just want to talk about the beer that I brought today. This is Love City Brewing Company, and our office is actually right around the corner.
Yeah, they are our hometown brewery.
It's a hometown brewery, but I saw in the store they had a new beer. It was called Lime City. So it's got some lime, salt, and it says crisp. I don't know what crisp means, but
well, I just want to say for everyone out there, Andrew, it's time for pumpkin beer. Next time,
all right.
Pumpkin beer.
We're barely in September now, so fine.
No, it's fall. Well, by the time we record next, it'll be fall. And
it'll be fall. Pumpkin beer next time. I'll find a good one.
Is my favorite, but we should find some local pumpkin beer.
All right, well, I am enjoying it, but let's continue our discussion on vaccinations. We started this whole series on vaccinations, and we're up to our part 3 in our series. We've now talked about some of the organizations that provide us with guidelines, so check out previous podcasts on that. We've talked about common vaccine reactions. We've talked about pre-medications. We've talked about treatments for vaccine reactions. And our last podcast was actually pretty in-depth on canine vaccine standards. So definitely listen to that one for some prerequisites for today's talk. Today, we're going to be talking about feline vaccination standards. So let's kick it off. Who's this one for, Marisa?
Everyone. No.
Always. It's always for everyone.
It is always for everyone. But, like I said last time, vaccines are in the news. Immunology is in the news. It's a great time to talk about it. And people take their pets to the vet mainly for vaccines. They know that they have to get their vaccines every year. And so this is very important for not only pet owners to know what their animals are actually getting, but also for veterinary practices and all the people in them so you can speak to them and also make sure that your protocols are appropriate.
Check last week's also. We talked a lot about vaccine basics, like the types of vaccines. So we're going to be discussing some of that today with the cat vaccines as well. There's some core vaccines. There's some non-core vaccines. There's a much better consensus with cats, I think, on what to vaccinate with versus dogs. I think there's a lot more variability with dogs.
Yeah, in general, cats have a similar vaccine schedule to dogs. They're started young, usually from 6 weeks or sometimes 8 weeks, depending. But we tend to see kittens earlier than puppies, right? I mean, Kittens come with their mom. They're very young. And so we can start as early as 6 weeks, some say 8, until a minimum of 16 weeks, just like we talked about in dogs.
Yeah.
And just like in dogs, the core vaccine, the FVRCP vaccine, which we'll get into, is repeated every 3 to 4 weeks until, I like to say 16 to 18 weeks, depending how it falls. And that's because, like you discussed last time, we want to hit them with the last vaccine once their maternal antibodies have waned.
Yeah, that's so important to understand. So can't emphasize that enough. All right, so let's just jump right into the 2 core vaccines in cats.
So the 2 core vaccines in cats are, like in dogs, rabies. The rabies vaccine is a core vaccine in cats. And that is because rabies continues to be fatal. There's no treatment for it, and it is a public health risk. And so every state has their own requirements, but most of the time, the kitten has to be 12 weeks of age or older. I am usually giving it once, usually at their last vaccine visit, so it's closer to 16 to 18 weeks because you are only giving one and not boostering it.
Yeah. Well, there are a couple of different kinds of rabies vaccines in cats, and this has become more and more important as general practitioners. We're going to have a whole nother podcast talking about vaccine site reactions in cats, specifically sarcomas that are induced by injections. I shouldn't just say vaccines, injections. So we'll talk much more about that. But I think that's a good place to start when talking about the rabies vaccine in cats because they've come a long way for cats, right? So tell us a little bit about the different types of vaccines that are available for rabies in cats.
So cats are my favorite animal, just so you know. And they've always...
How many cats do you have?
Just 2.
Just 2?
I used to have 4.
You need to add to that. Come on.
No.
I'm sure Lois would love that.
That's not true. She humps Teddy all the time.
Oh, God, poor Teddy.
We should put that in the show notes. Just a video of my dog humping my cat. Anyway, cats have typically been considered second-class citizens to dogs, unfortunately. And I was so happy to hear that they were developing a vaccine just for cats, especially for rabies vaccines and FELV vaccines. And so there are 2 types of rabies vaccines in cats. One is the inactivated whole virus. That's the one that has the adjuvant in it. And that's the same one that we talked about in dogs.
It's interchangeable. You can use it for either.
It is.
Right.
So like in shelter situations or high volume situations, that vaccine is used on both cats and dogs. And that's because it's much less expensive than the recombinant canary pox virus vectored vaccine. It's a lot of words, but that's the PureVax that we all
PureVax.
know.
Just remember PureVax.
Yes. PureVax is the one that is pure, AKA has no adjuvant in it.
So for those who are not in the vet field listening to this, you can request it. You can actually ask your vet because sometimes they definitely should have both.
Yes, but I do think it is worth it to bring that up with your vet if you are a cat owner. Make sure they do have the PureVax vaccine. It is very common now and definitely recommended, though it is more expensive.
Yeah,
but
it's worth it.
It's worth it.
It's worth it.
So regardless of which type of rabies vaccine you give, like I said, it's only 1 dose after 12 weeks of age, typically around 16 to 18 weeks of age. And that first one is 1 year vaccine.
Right, just like in dogs.
Correct. And then in cats, there used to only be a 1 year PureVax. And so cats were coming in yearly, getting their annuals, and then they were getting their PureVax vaccine that lasted for 1 year. Now there is a 3-year PureVax.
And there
vaccine.
actually is a difference.
There actually is a difference. Yes.
Yeah. So listen to last week's podcast on the difference between the 1 and 3 year vaccine for rabies for dogs.
There is no
really
difference.
Isn't anything. Exactly.
Spoiler alert,
Spoiler.
There's no difference. But yes, there is a 3-year PureVax now. There is a lot of talk about it's hard to get cats into the vet anyway. And so using the 1 year rabies vaccine guarantees that they're going to come in once a year to get their
dog break.
So if they're not kittens, if they're greater than 12 weeks, greater than 16 weeks, if they're an adult cat, they still only get 1 dose of rabies vaccine.
And no matter what your breeder tells you, don't wait until 6 months.
There is no research.
No research. And it's illegal. You have to have your pet vaccinated as soon as you have them. Really. I mean, as long as they
meet the requirements
of the 12-week minimum, they should have that vaccine.
And I will stress this, especially for cat owners, you're going to get a rabies tag for your cat. Most people don't put them on their cat's collar like you put your dog's tag on, but please keep that tag and keep the certificate that your vet gives you. That's the only thing that shows that your cat is vaccinated legally for rabies. So I just have a bunch of vaccine certificates with tags taped to them in my filing cabinet.
Great advice. Let's just jump to the next one because I think rabies is pretty self-explanatory. Everybody knows to go in. It's by law, so make sure you follow the laws and just listen to your vet and ask for PureVax. So FVRCP, let's talk about this one. This is oftentimes people come in and they say, oh, I need to get my cat their distemperment.
Just kidding.
And what they really mean is the other core vaccine, right? Which is this FVRCP. So what does it stand for?
Somewhat confusing that we were talking about. Some people use an H instead. So the F is obviously feline. VR, not virtual reality. VR is viral rhinotracheitis, which is herpes virus 1.
That's not confusing to people.
Right. The herpes virus is extremely common in cats, and so that's the VR part. And then the C is the Khaleesi virus, and then the P is panleukopenia or feline parvovirus.
You know what's so funny with the Game of Thrones thing a few years ago? Everybody was naming their pets Khaleesi.
I know, and I was like,
and all the veterinarians are like, "What are you doing? It's a virus."
Exactly.
Some cats were named Khaleesi.
So
like,
gross.
It's a virus that we actually vaccinate your pet for. So Anyway, Khaleesi virus and panleukopenia virus. Dogs have a panleukopenia virus, but it is different.
But there is some cross reactivity with these vaccines. Not that you would change them up, but panleuc in cats is parvo in dogs.
Yeah. All right. So the FVRCP, this core vaccine, it can be given in lots of different ways. Well, in 2 different ways.
Yes.
That we commonly see in practice. So one is down the nose. So a little squirt down the nose. What's nice is they make it in a couple of different styles and a couple of different types. One is a modified live, which we talked about last time. So it's actually live virus. It's just attenuated. Or a killed version. So it's dead. And that can be used in pregnant cats, pregnant queens, we call them.
Yes. And the reason we don't use modified live vaccines in pregnant queens is because of the risk for cerebellar hypoplasia in kittens.
Right.
So
That's a good point.
Yeah.
Thanks for pointing that out. And then, of course, most people are just used to the injectable or the parenteral version of the FVRCP. It's an injection, and that is always a modified live version. We're going to talk about best practices for injecting cats in a little bit, but let's talk about when to give this one.
So just like in dogs, this would be the equivalent to the DHPP or the DA2PP vaccine in dogs. And so as early as 6 weeks of age, cats are getting this vaccine every 3 to 4 weeks until at least 16 weeks of age. If you're seeing a cat for the first time who is not a kitten or is an older kitten, they do still recommend getting 2.
Yes. Okay, I was going to say that too, but dogs, they only recommend 1 after 16. So twice after 16 weeks in cats, once after 16 weeks in dogs. All right, cool.
I wanted to mention there is the intranasal, like we discussed earlier.
Yeah.
The reason there's an intranasal is that we thought we would be injecting cats less, right?
Yeah.
And so that would decrease the risk of their feline injection site sarcomas. However, then you have to weigh the annoyingness of holding a cat down and shoving something up its nose, number one. But also, the intranasal only lasts 1 year. And I think that's really important to say. Just like the Bordetella intranasal vaccine in dogs, it's every year. Whereas the injectable FVRCP, once they're fully vaccinated and then they get their yearly vaccine, it's every 3 years. So pick your poison.
And I know there's some controversy about whether or not we should even be vaccinating cats as they get older anyway. Some people believe that it's not worth the risk just because, most of these diseases affect kittens.
Yes, true. And the next disease we'll talk about, FELV, definitely the risk of that decreases with age, regardless of if, you're indoor or outdoor.
So that does bring us to the non-core vaccines. And like I was saying earlier, there aren't that many of them. In fact, there's really just one that is universally accepted. And this is the Feline Leukemia virus vaccine. Feline Leukemia virus is a pretty nasty disease that really just attenuates their lifespan. It really just cuts a cat's lifespan, unfortunately, by reducing its immune system and ability to fight off other diseases. And, leukemia is a cancer, so it can cause actual leukemia down the road. So what is the FELV vaccine? It comes in a killed form or a recombinant form. And it's non-core because it's not necessarily given to every cat. Although many veterinarians will give this vaccine to every kitten, at least in their first year of life. And then after that, again, weigh the risks associated with that cat's lifestyle. Mainly, this is a virus that affects outdoor cats. It affects young outdoor cats, to be honest with you. What else do you want to say about it?
FELV.
Sorry, I put you on the spot.
It affects outdoor cats, but really what that means is cats who have contact with other cats.
Yes.
So if you are someone who is bringing in cats to foster or bringing kittens to foster, this is extremely important. You need to keep them separated until they are tested, because if your cat is not vaccinated for FELV, then they are potentially being exposed, even if they don't go outside.
Yeah, and FELV is transmitted through saliva. So
Correct.
They could be drinking from the same water bowl and they could be passing this. Whereas FIV really is bodily fluids, cat bites mainly. So
right. So easier to get FELV from licking and sharing things versus more difficult to get FIV, like through cat bites.
So I always recommend to people, give them the first year's dose of FELV, which is what?
I also agree with you, and I also try to do that and educate people that we're going to give 2 doses 3 to 4 weeks apart. I usually start mine at the 12-week visit and then give the last one at the 16-week visit. And then I will reevaluate it at their 15-month-old visit, whether they need it or not. But definitely they are at most at risk when they're a year and under. And in a cat that doesn't have regular exposure to FELV positive cats, you can give the vaccine every 2 to 3 years as per the AAFP. But if they're at risk, like they fight a lot or they have a mostly outdoor lifestyle, they should be continued to vaccinated against FELV annually. The task force for AAFP, the consensus is to revaccinate every 2 years in a periodic exposure situation in mature cats.
Okay, thanks. Another thing is, I know we're going to talk a little bit about where to give these vaccines, but there's a particular place that we like to give this particular vaccine. Since it is a non-core vaccine, we all want to know in the future if there's a vaccine site reaction. We want to know that it was in the left hind limb. And we'll talk more about that. All right, so there is an FIV vaccine. It's debatable whether or not there's one in the United States currently, but in some countries they do use it. It's really not widely accepted. It is a killed vaccine. It can be given after 8 weeks of age, and it requires 3 doses, actually. So 3 doses, 3 to 4 weeks apart. The problem with it really is that if you ever test a cat that has this vaccine, it'll come up positive. I think that's probably one of the major reasons we don't use it. A, it's not that effective. And B, if your cat ever gets lost and is found and they run an FIV test, they may euthanize. And that's another reason to really just make sure your cat is microchipped.
I've never been in the presence of an FIV vaccine.
No, neither have I.
In school or in my career. So not recommended.
There's another one for that list too, Bordetella. We give that to dogs. It does exist for cats as well for the same reason, but really not that big of an issue in cats. And so it's really hardly ever used. I've never seen it used in a cat. Have you?
No.
Okay. So there are 2 others. One is the FIP. Another vaccine that we really don't see. The problem with FIP for anybody in the vet world, it comes from coronaviruses. Don't get confused with all the coronaviruses, that are in the news right now, but it is a coronavirus. And unfortunately, most kittens are exposed to these coronaviruses before they would even be vaccinated for this. We can talk about how the disease progresses and the pathogenesis of it, but basically, it's just ineffective. So FIP vaccine, ineffective. You don't need it.
Don't use it.
The last one on my list here is the Chlamydophila vaccine. Now, Chlamydophila is a bacterial disease. It's something that affects a lot of kittens, but it's pretty easy to treat with just topical meds. And so it's really not used. It's not really a deadly disease at all. Nobody uses it. I've never seen it.
I've never seen it.
All right, so Marisa, this is the last part of our podcast. Talk to us about the site of feline vaccinations. Where do we vaccinate cats?
Oh, man. I think we can all remember when there was this big push to vaccinate all cats in their tails.
Yeah.
Which is still, the AAFP still has that site on their recommendations that were just updated in 2020. So if you have been vaccinating cats in the tail, A+ to you. I've only attempted.
It's not easy to do.
It's not easy to do.
There's no sub-Q space.
No, it's very difficult to do, in my opinion. In general, you want to vaccinate cats as distally in the limb as possible. So feline leukemia, distal left hind limb. And that is, for me, between the stifle and the tarsus, the stifle and the paw, basically.
Yeah.
Anywhere in there that you can get it. And then FVRCP is usually distal right front limb and rabies distal right hind limb. And you want to make sure that you do note that in your record, of course, not only where you gave it exactly, but which vaccines you gave where. And there are some tips. Obviously, there's lots of new stuff out in fear-free in cats, towels and feel away and burritoing them into a towel so you can have access to just their lower limbs. And I think as a profession, we do need to be better at focusing on that. We know it can be hard to inject cats, but I think we need to take our time.
Yeah, and I think also for any veterinarians listening to this, it's something that we're all trying to do. And certainly talk to your technicians before you just go for it, because they might not be ready for you to do that. And, you certainly want them to be holding the cat in the right way. Just make sure everybody's on the same page, communicate really well. Even talk to the owner about why you're doing that, because they might be like, what? I've never seen it done that way.
Exactly. Communication is key, and you will save kitties' lives. All right, so next time we're going to go much more in depth on injecting cats and why it is dangerous, and we're going to talk a lot about that. So you and I have a lot of research to do there. But I wanted to thank everybody for listening today. Tell your friends, leave us reviews, give us a rating, and we hope to see you next time. Cheers. Cheers.